So by 1970s or 80s, we were using a combination of chemotherapy, radiotherapy, and surgery to treat the cancers. Okay. One of the things which I, is an area of research, or at least I want you to think about that, is called differentiating therapy. Have you heard of the term differentiating therapy? No? So, differentiating therapy is that in the Chinese philosophy, have you heard of philosopher Confucius?
Yes, sir.
Chinese philosopher Confucius. So he used to say that so all cancer cells are kind of a Buddha cells. They don't follow the rules, right? They are thieves. They are Buddhas. So he said कि जो आपकी सोसाइटी में बुड्ढास हैं, उनको आप अगर मारोगे तो आप you can never, take out the crime from the society. He said उनको आप मॉडिफाई करो, उनको डिफरेंशिएट करो, उनको आप बोलो कि आप अच्छे सोसाइटी, उनको अच्छे वाले चीजों में डालो, उनको अच्छे लोग बनाओ. So this is kind of a differentiation that the cancer cells are disordered, as I said before. तो उनको अगर आप differentiate करके normal cells बना देते हो, that is called differentiating. So cancer cell, as I said, is self-renewal and unspecialized. But if you do the differentiation, so these immature cells or disordered cells will become mature and they will start functioning normally. So in 1980s, one of the agents which was used to differentiate was retinoic acid. What is retinoic acid?
Vitamin.
Vitamin A, right? So can you imagine a vitamin was used to differentiate the cancer cells? So this was the one of the leukemia which is called acute. So it is a type of blood cancer where almost everybody dies. There was hardly any treatment which was available. The scientist or the oncologist used to give chemotherapy, but most patients used to die. So in 1986, the people gave retinoic acid, and this came from the Chinese indigenous medication. And they saw that if you are using the cis form of retinoic acid, so retinoic acid has two forms, cis form and trans form. So they say if you use the cis retinoic form of the vitamin A, these cancer cells they differentiate and this leukemia becomes normal. How it is? From the chemotherapy you are going to a differentiation. So this was the team of Chinese scientists who used this. This is called trans retinoic acid (ATRA). In 1987, they developed this, but in 1989 something happened in China. You know what happened in 1989 in China? History and news. Have anybody gone to China? No. But in any case, there was a democracy movement which took place in Russia as well as in China. So the Chinese government, which was a communist, they actually crushed all the democratic students, and there was a kind of massacre which went into thousands of students and the people who were protesting against the communism. And there was a scare called Tiananmen scare, where this massacre took place. So a lot of countries they stopped talking to China. At that time, this was being developed. So all the research actually went down, but the France were the one who were still communicating with Chinese scientists, and this actually was from the China went to France, where the Roche company took over this form of medicine and they start manufacturing at term. So this comes as a and this was published in finally 1987. So advanced retinoic acid. This is New England Journal of Medicine, which is considered as one of the topmost journals where the research is published. Besides Nature journals, so New England Journal of Medicine is one. So this was published. Advanced retinoic acid you can give and you can cure many of these. The other thing which took place at that time, again in China, and again I would say, I'm giving you this example just to stimulate you people that you can do a lot of things. Is they used KD1 therapy or arsenic. Again, in this type of thinking. And they saw that when you are using arsenic, this leukemia is getting controlled. So arsenic otherwise is a poison, you all know. But they say if you use a small dose of arsenic, that also works in this kind of a cancer. So this is a Chinese paper which was published in 1997. Arsenic dioxide in the treatment of cancer, and they saw out of 10 patients, 90% of patients became cancer. And this is, arsenic is one which is used in our Ayurveda for time immune. But we could not, do this kind of a research. It should have come from India because the arsenic is used in Ayurveda for long. So I'm just showing this paper, arsenic and Ayurveda. Even this paper is written by somebody who came from UK, and they said, okay, you can use arsenic. We did not do this kind of a research. So these days we now use a combination of vitamin A and arsenic to treat these cancers, which was almost hidden few years back, but now it is highly curable, highly curable. So this is one of, so we have been using a combination of arsenic with that drug in our patients. So a vitamin and a metal without chemotherapy in these patients. And these are, more than 90% of our patients are surviving for this type of cancer. In fact, both arsenic and tetra, if somebody is a poor patient, he comes to PGI, we provide this as a free of cost because we know this is a high curable cancer. So in the first week or 10 days, these patients are very sick. So if they pass through that phase, after that they are cured. So this is a differentiation therapy which came from the philosophy of Confucius. So you can think of the differentiating agent which can, from the disordered cell growth, they can make it ordered.